Good morning.
Good morning, ma'am.
I am Dr. Janjinet Labastida. Can I verify your name and age, please?
My name is Marmita, 33 years old.
Okay. Do you know where you are right now?
I am in Labastida Clinic in Tanza, Cavite.
Okay. Do you know what day is today?
Today is March 3, 2021, Wednesday.
Wednesday, okay. So do you know what is the reason why you are here?
I came here for cardio checkup or cardio appearance.
Okay, good. So now you already know, so I'll be doing a cardio physical examination. So this will require me to touch you and ask you to do some maneuvers. So is that okay with you?
Okay lang ba?
Okay, good. So rest assured that everything that we do here is treated with confidentiality and will only be used for your management, okay?
Okay.
So do you have any questions?
Ma'am.
Okay, so let's start. So just be steady while I am doing some inspection, okay? And I'm just also observing your breathing right now. Okay, do you have any pain?
Pain? Ma'am.
Okay, so do you easily get tired when you do like activities such as climbing stairs for a few steps or walking for a few meters only?
None.
So none. Okay, good. So based on my assessment to the patient, he is fully conscious and coherent. The patient was able to answer me well when I asked him a few questions earlier. So there's no toxic words or short sentences. So for his breathing, so right now there's no tachypnea, gasping or deep breathing. So he seems relaxed, so no irritability and restlessness or anxiety. And the patient doesn't feel any pain. And there's no excessive sweating or diaphoretic. And there's no easy fatigability. So for his physical build-up, he's endomorphic. Okay, let's proceed for the vital signs. Okay, sir, I will be starting your vital signs, okay? So can I have your hand? I will be checking your radial pulse. Okay, the other hand. Okay. Now, for the careful pulsation. Okay, so both the radial and the brachial pulsations are regular and symmetrical, so it's grade 2 plus. Next is I'll be checking your temperature. Okay, and I want you to cross your arm across your chest. Okay. Okay. Your temperature is 36.9. That's normal. Lastly, I'll be checking your blood pressure. It's a bit high. Okay. For the summary, the heart rate is 86 and then the respiration rate is 18 and the BP is 140/90. So that's a bit high. It's already a hypertension stage 1. So the hypertension stage 1 ranges from 140 to 159/90 to 99. Okay. The next is orthostatic hypotension, but I will not be doing it, so I'll just explain the procedure. So in checking for orthostatic hypotension, the patient's BP or blood pressure is measured both while sitting and standing, and then compare the measurements after. Then the doctor will diagnose orthostatic hypotension if the patient have a drop of equal or greater than 20 millimeter mercury in systolic blood pressure, or a drop of 10 millimeter mercury in diastolic blood pressure within 2 to 5 minutes of standing, or if standing causes signs and symptoms like lightheadedness and dizziness is considered abnormal. So also for pulsus paradoxus, so I will not be doing it, but I will be explaining the procedure also. So for pulsus paradoxus, it is defined as a systolic pressure drop greater than 10 millimeter mercury with respiration. So to test the pulsus paradoxus, slowly look for the first corrupt cough sound that will appear and then disappear. So during inspiration. So the next is slowly listen for when the corrupt cough sound no longer disappear with inspiration. So if the pressure drops greater at 10 millimeter mercury, it is already an abnormal finding. So the pulsus paradoxus can be seen in patients with tamponade, constrictive pericarditis, and so on. Okay, so let's now proceed to other tests. Sir, now I will be checking your HAMP. So can I touch your face?
Right.
Okay. So there is no scleral pallor. The circumoral area has no pallor and no cyanosis. Can you open your mouth? Okay. Can you put your tongue up? Please lift. Okay. So the buccal cavity has no pallor, especially the sublingual area. Okay. So thank you, sir. Now can I see your neck? Okay. The jugular vein is not distended. So it's okay. So now we will be checking for a thyroid mass of the neck. So, sir, I will touch your neck. Okay. So can you swallow? Okay. So there is no enlargement of the thyroid and the thyroid cartilage moves upon deglutition. Now the patient is lying down with head elevated at 30-degree angle. So sir, can I open this one? I will be checking now for the carotid pulse. Okay, sir, can you move your head there? This side. Okay. Be sure not to press both sides of the carotid artery at once because it will be very dangerous for the patient. Okay, the other side. Okay, good. The carotid pulsation have strong, equal, and regular pulsation with soft consistency of the carotid artery wall. Now I'll be checking for the bruit. So I'll be using the bell side of the stethoscope so that I could hear the low pitch sound of the bruit. Okay, it's negative for bruit. Next, I'll be checking for the JBP using these two rulers. So let's find for the sternal angle first. Okay, this side. Now let's find the jugular vein distension, and you can see it here. So let's measure. Okay, it's 1.5 centimeter and it's normal. So let's check for the it's hepatojugular reflux that I'm doing right now. For the summary, so the JVP of the patient, as I mentioned, is 1.5 centimeter and that's normal. So if the patient has 3 to 4 centimeter above sternal angle, that is considered above normal and this could indicate a possible right-sided heart failure. So for the hepatojugular reflux, the patient's jugular vein distended for a few seconds only and it disappears. So if the jugular distension does not disappear for a few seconds, there must be an underlying pathologic condition. Now let's check for the heart. First, I am going to inspect the PMI or the point of maximal impulse. So the PMI is located in the 5th intercostal space of the mid-clavicular line. Okay, so I'm going to palpate the PMI now. Okay, the apex pit is not displaced in the left side. Okay, and now I'm going to check for the heaves. The heaves is negative. And then I'm also checking for the fremitus. Okay. Okay, fremitus is negative also. And then lastly, I'm going to palpate for the thrills using the tip of my fingers. Okay, thrills is negative also. Now I will be auscultating the chest using the diaphragm of the stethoscope for the high-pitched sound of the S1 and S2. First, let's check the aortic valve. Now the pulmonic valve. Okay. The Erb's point. Okay. And while doing this auscultation, I am also checking for any murmurs. Okay. Now the tricuspid valve. And lastly, the mitral valve. Okay. Next one, I'll be checking for the low pitch S3 and S4. So I will be using the bell part of the stethoscope. Okay. Okay, sir, can you move up this side, please? Okay. Can you inhale and exhale deeply and kindly hold your breath after? Okay. Okay, good. Thank you. So the S3 and S4 is not appreciated. So there is no extra sound of the heart. So for the entire auscultation, I have not heard of any murmurs. But for the gradation of murmurs, so we have 6. So for the grade 1, grade 1 is very faint. It may not it may not be heard in all positions. And the grade 2, it is quiet. And after placing the stethoscope on the chest, it can be heard immediately. And for the grade 3, it is moderately loud. For the grade 4, it is loud with palpable thrill. For the grade 5, it is very loud with thrills, but it may heard when the stethoscope is partly off the chest. And the grade 6, it is very loud with thrills, but it can be heard when the stethoscope is entirely off the chest. Now, we will be doing the chest and lung examination. So as you can see, our patient is already in a sitting position. So we can start now by doing first the inspection of the chest. So sir, can I open your chest? There is no gross deformities, no surgical scars, no chest retraction, and there is no visible mass. So now I am going to palpate the chest to check for any tenderness and mass. Okay. Okay. So negative for palpable mass and tenderness. Okay, now we will be checking the lungs. So sir, I would like you to turn around so that we can check well your lungs. Okay, now we will be doing a lung examination. So first we will do the inspection. Okay, no gross deformities, no surgical scars. Okay, no chest retraction, and there is no visible mass. Okay. Sir, we will do the palpation. So whenever my hand touch your back, say 99. Okay?
99, 99, 99, 99.
Okay, so there is equal and equal tactile fremitus. So now let's do the percussion. Okay, the entire lung is resonant. So now we will be doing the auscultation. Sir, can you inhale? Exhale. Okay, for the auscultation of the lung, so there is negative for any adventitious sound. Okay, now the patient is already lying down, so we can now check for the lower extremities. So, sir, can I pull up this hands? Okay.
Other side.
Same with the other side. Okay. Okay, so now we can do the inspection. So as you can see, there is no cyanosis and pallor. So there is also negative for varicosities and hyperpigmentation. Okay. Now I will be checking for the temperature of the skin. Okay, negative for cold clammy skin. So we can also check for the capillary refill. Okay. The capillary refill is less than 2 seconds, so that's normal. Now let's check for edema. So let's start here. Okay. Okay. So there is negative edema. Okay. So there is grading system to edema. So first we have +1. So it is there is indentation for 2 millimeter, and it can barely detectable. So it can easily rebound. And then we have the grade 2 plus edema, which has an indentation of 4 millimeter, and it can also rebound immediately for a few seconds. And then we have the grade 3 plus edema, which has an indentation of 6 millimeter, and the rebound will take for 10 to 12 seconds. And we have also the grade 4 plus edema, which has a 8 millimeter indentation, and the rebound will take for more than 20 seconds. So now let's check for the dorsalis pedis up pulse. Okay. Okay, so there is equal and regular pulse. Now let's check for the popliteal pulse of behind the knee. Okay, there is also equal and regular pulse.
So that ends our cardiovascular physical examination. So thank you, and thank you also to my patient for the cooperation.